Welcome. After completing the theory, we are now moving to the practicals. In practicals, you have spotters, prescription writing, CCR, that is, decide correct and rewrite the wrong prescription, clinical problems. Then you have some experiments and the experimental pharmacology. Coming to spotters, you will be given a picture and 2 or 3 questions where you have to identify the spotter and whatever the questions are asked regarding that spotter, you have to answer. Here, the question is identify the plant and mention the alkaloids obtained from it. What are the therapeutic uses of the alkaloids derived from this plant? Here, for every spotter, you are given 1 minute to write, where you will identify that spotter and write the relevant answers. Identify the plant and mention the alkaloids obtained from it. The plant is Papaverum somniferum, and the alkaloids obtained from it are opium alkaloids, which are divided chemically into. I'll be reading the slides by a bit slow. You have to write all these spotters in the record book. The plant is Papaverum somniferum, and the alkaloids obtained from it are opium alkaloids, which are divided chemically into phenanthrene series. In that we have morphine, codeine, thibine. Phenanthrene series, morphine, codeine, thibine. Benzyl isoquinolone series. Benzyl isoquinolone series. In that we have papaverine, noscapine, norcin. Papaverine, noscapine, norcin. What are the therapeutic uses of alkaloids derived from this plant? The therapeutic uses of the alkaloids derived from this plant are for the relief of pain, especially visceral pain. For the relief of pain, that is visceral pain, it is used in acute left ventricular failure, acute left ventricular failure, as pre-anesthetic medication, to control diarrhea. That is codeine sometimes used to control diarrhea, codeine. Erectile dysfunction, papaverine used, and is given as intracavernosal injection. Intracavernosal injection. CAVRNOSAL. cavernosal injection. Cough, noscapine. Cough, noscapine. So for the relief of pain, acute left ventricular failure, pre-anesthetic medication, diarrhea, erectile dysfunction, cough. Some of the extra points regarding this papaverin. Somniferum. Opium. Opium tears. Opium is the dried latex obtained from opium poppy, that is Papaver somnifer. Opium latex contains approximately 12% of the analgesic alkaloid morphine, which is processed chemically to produce heroin and other synergistic and other synthetic opiates for medicinal use. The latex also contains the closely related opiates codeine, thibine, and non-analgesic alkaloids such as papaverin, noscapine. The traditional labor intensive method of obtaining the latex is to scratch the immature seed pods, that is fruits, by hand. The latex leaks out and dries to a sticky yellow residue that is later scraped off and dehydrated. For the illegal drug trade, morphine is extracted from the opium, reducing the bulk weight by 88%. It is then converted to heroin, which is 2 to 4 times as potent and increases the value by 2 to 4 times. The reduced weight and bulk make it easier to smuggle. Opium is widely used for medicinal purposes in the form of poppy-based drugs like morphine, codeine, papaverin, and other alkaloids. Opium-based medicines are considered the most effective way of relieving the severe pain. Opium is a stimulant that induces euphoria and helps get rid of anxieties, tensions, fear, and inhibitions. It is frequently administered to relieve pain and for calm excitement. Opium seeds contain cough suppressant and analgesic properties and are often recommended to relieve minor pains. The plant is used to treat intestinal, stomach spasms and respiratory spasms triggered by asthma attacks. Opium is used to treat cancers of the skin, stomach, tongue, breast, vagina, uterus. The plant provides two main food ingredients, namely poppy seed and poppy seed oil. The seeds do not contain opium and are extensively used in baking. Poppy seeds are source of drying oil that is used for manufacturing paints, varnishes, and soaps. A high dose of opium poppy is highly addictive and can decrease respiration. Opium is used as a remedy for bladder, bruises, cancer, cold, colic, conjunctivitis, diarrhea, dysentery, enteritis, fever, headache, hypochondria, hysteria, inflammation, insomnia, mania, neuralgia, otitis, prolapse, rheumatism, snake bite, sprains, swelling, toothache, ulcers, and tumors. These were the extra points regarding this plant. Next, spotter. Identify the plant and mention one alkaloid obtained from it. Name two poisonings where this alkaloids is used. Identify the plant and mention one alkaloid obtained from it. The plant is Atropa belladonna and the alkaloid obtained from it is atropine. The plant is Atropa belladonna and the alkaloid obtained from it is atropine. The two poisonings where this alkaloid is used, one is organophosphorus poisoning, the other is physostigmine poisoning. Organophosphorus poisoning, physostigmine poisoning. Third spotter. Identify the plant. What are its uses? The plant is Digitalis purpurea, also called foxglove. The plant is Digitalis purpurea, also called foxglove. What are its uses? Its uses are: digoxin is useful in congestive heart failure associated with atrial fibrillation and rapid ventricular rate. Digoxin is useful in congestive heart failure associated with atrial fibrillation and rapid ventricular rate. Digoxin is useful in low output failure in valvular, hypertensive, ischemic, and congenital heart diseases. Digoxin is useful in low output failure in valvular, hypertensive, ischemic, and congenital heart diseases. Digoxin is useful in atrial flutter. Digoxin is also useful in paroxysmal atrial tachycardia. Identify the plant and mention the alkaloids obtained from it. What are the therapeutic uses of alkaloids derived from this plant? The plant is Vinca rosea. The plant is Vinca rosea. And the alkaloids obtained from it are vincristin, vinblastin, vindesin. The alkaloids obtained from it are vincristin, vinblastin, and vindesin. What are the therapeutic uses of alkaloids derived from this plant? The therapeutic uses of alkaloids derived from this plant are: vincristin is useful in the treatment of acute lymphatic leukemia in children. Vincristin is useful in the treatment of acute lymphatic leukemia in children. Vinblastin sulfate is mainly useful in Hodgkin's disease, methotrexate-resistant choriocarcinoma, lymphoma, and lymphosarcoma. Vinblastin sulfate is mainly useful in Hodgkin's disease, methotrexate-resistant choriocarcinoma, lymphoma, and lymphosarcoma. Vindesin is useful in the treatment of leukemia, lymphoma, and melanoma. Vindesin is useful in the treatment of leukemia, lymphoma, and melanoma. Identify the spotter and name the drug derived from it. Mention its uses. The spotter is cinchona bark, also called cinnamon, and the drug derived from it is cinchona alkaloids, quinine and quinidine. Identify the spotter and the name derived from and name the drug derived from it. The spotter is cinchona bark, cinnamon, and the drug derived from it are cinchona alkaloids, quinine and quinidine. Mention its uses. Its uses are cinnamon is used as antiflatulent and in nutraceuticals. Cinnamon is used as a antiflatulent and in nutraceuticals. Quinine is used in treating malaria, cerebral malaria, chloroquine-resistant malaria, myotonia congenita, and nocturnal leg cramps. Quinine is used for treating malaria, cerebral malaria, chloroquine-resistant malaria, myotonia congenita, and nocturnal leg cramps. Quinidine is antiarrhythmic drug. Quinidine is antiarrhythmic drug. Identify the device and write its uses. The device is identified as conventional insulin syringe. The device is identified as conventional insulin syringe. It is used by diabetes patients to inject insulin. Insulin syringe is used by diabetes patients to inject insulin. Some of the extra points. Insulin syringe has 3 parts: needle, barrel, plunger. The needle is short and thin, covered with a fine layer of silicone to allow it to pass through the skin easily and lessens pain. A cap covers and protects the needle before its use. There are 40 units, 100-unit syringes available in India. Here the spotter shows PABA, that is para-aminobenzoic acid, is converted to dihydroteric acid with the help of dihydrooctavate synthetase. Dihydroteroic acid is converted into dihydrofolic acid with the help of dihydrofolate synthetase, and dihydrofolic acid is converted to tetrahydrofolic acid with the help of dihydrofolate reductase. Here the questions are asked. Name the drug which inhibits site A shown in the diagram. Name the drug which inhibits site B shown in the diagram. And what is this phenomenon called as? The drug which inhibits site A shown in the diagram is sulfamethoxazole. The drug which inhibits site B shown in the diagram is trimethoprim. The, the phenomenon is called as sequential blockade. The phenomenon is called as sequential blockade. When coming to the picture of spotter, here bacteria synthesize their own folic acid from PABA, that is para amino benzoic acid. Bacteria synthesize their own folic acid from para amino benzoic acid. Sulfonamides, being structural analogues of PABA, sulfonamides, here it is sulfa methoxazole, being the structural similarity with PABA, inhibit the enzyme dihydropteroate synthesis and prevent the formation of dihydropteroic acid. So, sulfonamide, being the structural analog of PABA, inhibit the enzyme dihydropteroate synthesis and prevent the formation of dihydropteroic acid. Trimethoprim inhibits bacterial dihydrofolate reductase and prevents the formation of tetrahydrofolic acid. Trimethoprim inhibits bacterial dihydrofolate reductase and prevents the formation of tetrahydrofolic acid. Thus, both sulfamethoxazole and trimethoprim cause sequential blockade of folate metabolism. So, different drugs are acting in the same metabolic pathway, which are individually bacteriostatic. When combined, becomes bactericidal. Two different drugs acting in the same pathway, helping each other. That is synergism. And those drugs are synergistic drugs. The two drugs are in the same pathway, causing blockade to the metabolism. So we call it as a sequential blockade. Here sulfamethoxazole and trimethoprim in the combination is available as a co-trimoxazole. Sulfamethoxazole and trimethoprim in the ratio of 5:1 ratio. Earlier, as individual drugs, sulfamethoxazole is bacteriostatic. These two drugs, when combined and given in a combination, become bactericidal. So the drug which inhibits site A shown in the diagram is sulfamethoxazole. The drug which inhibits site B shown in the diagram, trimethoprim. The phenomenon is called sequential blockade. Identify the instrument and mention its uses. The instrument identified as Marriott's bottle. The instrument is identified as Marriott's bottle. It is used as a reservoir in frog heart perfusion experiment to hold frog ringer solution. Marriott's bottle is used as a reservoir in frog heart perfusion experiment to hold frog ringer solution. Some of the extra points regarding Marriott's bottle. Marriott's bottle was named after a French physicist, Edmé Marriott. It consists of an aspirate bottle fitted with a tight stopper, perforated by a glass tube reaching nearly the bottom of the bottle. It is employed to maintain the steady pressure. Marriott's bottle is employed to maintain the steady pressure. It is used in perfusion of frog heart in situ experiment. It is used in perfusion of frog heart in situ experiment. It is used as a reservoir in frog heart experiment. It is used as a reservoir in frog heart experiment, and the flow of the ringer solution in the Marriott's bottle is adjusted during the experiment. The flow of the ringer solution in the Marriott's bottle is adjusted during experiment. Marriott's bottle is a device that delivers a constant rate of flow from the closed bottles. A stoppered reservoir is supplied with an air inlet and a siphon. The pressure at the bottom of the air inlet is always the same as the pressure outside the reservoir. That is the atmospheric pressure. If it were greater, air would not enter. If the entrance to the siphon is at the same depth, then it will always supply the water at the atmospheric pressure and will deliver a flow of under constant head height regardless the changing of water level in the reservoir. This apparatus has many variations in design and used extensively when a constant water pressure is needed. For example, supplying water at constant head for measuring water infiltration into soil, or supplying the mobile phase in chromatography. So the instrument here is identified as a Marriott's bottle used as a reservoir in the frog heart perfusion experiment to hold frog ringer solution. Then coming to the instruments. Identify the instrument and mention its uses. The instrument is identified as a simple lever. The instrument is identified as a simple lever. The simple lever is used in frog rectus muscle experiment to record the contraction of skeletal muscle. Simple lever is used in frog rectus muscle experiment to record the contraction of skeletal muscle. Some of the extra points regarding the frontal lever, writing lever. No. Simple lever. Simple lever This is the simplest form of the lever, but it gives a curved line when the preparation contracts. Simple lever is used for skeletal muscle contractions. Simple lever is used to note down the contractions of a frog rectus muscle. The distance from the attachment of the tissue to the fulcrum and fulcrum to the weight should be equal. Magnification is a distance between simple lever and fulcrum divided by distance between fulcrum and tissue. The complete simple lever assembly consists of simple lever as a mounting rod. The fulcrum of the lever is held in an adjustable needle bearing with stout jaws. The simple lever, and it is used in frog rectus muscle experiment to record the contractions of skeletal muscle. Identify the instrument and mention its uses. The instrument is identified as frontal writing lever. The instrument is identified as a frontal writing point or the frontal writing lever. It is used to record the contractions of smooth muscle, the rabbit duodenum, and guinea pig ileum experiment. The frontal writing lever is used to record the contractions of smooth muscle in rabbit duodenum and guinea pig ileum experiment. The actual, some of the extra point, the actual shortening of the muscle is magnified in linear proportion on the drum. The long frontal writing point made up of glass capillary is attached to the end of the strip by means of a hinge. As the point is hinged and the lever writes frontally, it gives a straight line when the preparation contracts. The frontal writing lever is used for smooth muscle contractions. It is used to record contractions of smooth muscles, rabbit duodenum experiment, and guinea pig ileum experiment. The frontal writing point consists of a plastic yoke that fits on the end of the mounting stem. The yoke carries an aluminum wire that wraps around and holds 527681 ink pen. The individual components are also available separately. The instrument is frontal writing point or frontal writing lever. It is used to record the contractions of smooth muscle in the rabbit duodenum and guinea pig ileum experiment. Identify the instrument and mention its uses. The instrument is identified as Starling's heart lever. The instrument is identified as Starling's heart lever. It is used in the frog heart perfusion experiment to record the contractions of frog heart muscle. It is used in frog heart perfusion experiment to record the contractions of frog heart muscle. Starling's heart lever, some of the extra point, it is used for a frog heart experiment. It is used to record contractions of the heart. It is used to record diastolic contractions. Starling's heart lever has an arm that is pierced with 6 holes of 5 mm pitch from the fulcrum point. The spring tension is adjustable. The spring is adjustable. The lever can be mounted on any standard diameter rod. The lever is supplied with 52 0686 ink pen. It consists of a frame carrying a light lever arm with a hole and notches supported by a fine adjustable nickel silver spring attached to an adjustable hook. Stylus or writing point for various side writing lever can be made from light celluloid, parchment paper, or a thin photographic or X-ray film. So here the instrument identified is Starling's heart lever. It is used in frog heart perfusion experiment to record the contractions of frog heart muscle. Thank you for active listening and write all this in record.